And I'm Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
Sure, you had to ruin it right away, Brad. I was thinking we really were, so. Okay, what are we going to talk about to the folks today, Brad?
Well, this is something that in the clinic we both use on a regular basis, and sort of many therapists as well as some chiropractors, and that is the use of the ultrasound. And we're going to go one step further and do phonophoresis as we have up here. And don't get scared. I talk to patients. I say, well, we could try some phonophoresis, you know, on your shoulder or your elbow, and they look at me like,
yeah,
phonophoresis.
it sounds like a very terrible word, doesn't
Right,
it?
yeah.
Intimidating word.
Right, so let's break it down and
Sure.
find out what exactly phonophoresis really means.
All right, well, phono just means sound, and I'm sure in this instance, they're actually just referring to the ultrasound,
Right.
which are ultrasound waves. Which, by the way, we should mention, many of people have heard of ultrasound, but they think of it in terms of, you know, they use it to diagnosis as far as, or looking at their baby or,
Right,
or something.
pregnancy, or
Yeah.
looking for a blood clot type of a
Right.
thing. This is a different type
This
of...
is treatment ultrasound, this is not diagnostic ultrasound, so we're actually using the waves to treat as opposed to diagnose.
Right. So we know what phono is, and what about this phoresis?
Phoresis means transmission, so what we're trying to do is transmit normal topical medication, and we're trying to transmit it through the skin deep down into the tissues. So we're going to use this machine to do that, and this is a simulation of the ultrasound head.
Yeah, so this is the
head.
actual ultrasound head that we would use. As you see, connects up to the primary unit that generates the energy for the unit.
And there's a little crystal in there.
Yeah.
Vibrates real rapidly and creates ultrasound waves. Now we can use this machine just to provide heat, deep heat. In fact, it can heat up to the point where it actually can heat up the outer layer of your bone.
That's not fun.
That's not fun, no. But the cool thing about this is, you know, as it pushes the medicine in, it's totally painless. So there's no, I mean, the idea here is that you might use this instead of getting a shot. Like if you're thinking about getting a cortisone shot for some type of inflammation you have, this would be something that would be better to try first.
Right.
And generally, the disadvantage I would say is that it takes usually several treatments before it is successful.
Right.
What I typically tell patients is that if it hasn't gotten better in three treatments, I mean that we haven't seen any improvement, then it probably isn't going to help.
Right.
If it has helped after 3 treatments, I'll go on and do more treatments after that, but is that your case?
And I like to go 3 times a week. I like to do a Monday, Wednesday, Friday. Spread it out to the week if that fits. And of course, every case is a little different, but these are some general rules.
So again, yeah, what we got here is, do you got the black marker?
Yes, I've got it right here.
So
Bob.
this is, well, so we put down a gel, which actually the ultrasound in order to work has to have a gel. But the gel is mixed in with the type of medicine we're going to use, and there's different types of medicines we use.
We had some gel.
The gel's over there.
Oh.
Anyway, so we lay down this gel on the surface of the skin. You know, this is your body or body part here. And this head then, here comes the gel.
Throw it in here.
That's one of the gels. Yeah, that's gel without the medicine in, and this is gel with the medicine in. So anyway, the head of the ultrasound would actually rub, you know, it rubs on the skin and it actually drives the medicine down into the surface, opens the capillaries so that they can take the medicine and bring it down. Now, I've read, and this has been a long time since I've read this, but that it can go down as much as 5 centimeters.
That's quite
Which is a lot, which is 2 inches. So,
Right.
I mean, you think about that, you know, whatever body part you do, if you're driving that medicine down 2 inches, that's deep.
Right.
And it's a lot deeper than what normally, if you just took aspirin cream or some other medication to put on there. We're always using an anti-inflammatory medication. It's very important what type of medicine you use, because certain medicines can work with the ultrasound, and certain medicines will, you know, are better for driving through the skin. There's a certain combination that you need to fulfill both of those. I want to give just a personal story. I know I'm talking more than you, Brad.
Yeah, I'm
really
agitated. I'm ready.
Yeah, he's ready to go.
Go on, tell
But he
your
didn't have a
story.
personal story, but I hurt my foot once on a runner, and I was putting up with this for, I would say, a month. and I was icing it, and it just was not getting better. Finally, I'm thinking, I'm a therapist, why am I doing this? I did some ultrasound, I swear to God, that thing got better in 2 days. I mean, it was amazing.
What part of your foot?
Right on top of my foot. It was a weird injury.
Really?
Yeah, it was just,
Weird.
it was really inflamed, and this just, of course, because I'm a therapist and I have a machine, I did it twice in 1 day and a third time in the second day.
Right.
So, I mean, but it got better fast. What are some, Brad, since you want to talk here,
Yeah.
you can look contraindications. Where are places that you're not gonna do this?
Well, I just have them memorized, Bob.
Watch his eyes.
When you do it close over the bone, like if you have an injury by the knuckle or on the elbow where the bone is right under the skin, I don't do it there because I've actually tested myself with that. When you ultrasound over a bone and you hold it, it's very uncomfortable, and you don't
Right.
want to do that to a bone. If the person has a history of cancer in that area, you can stay away from that.
Sure.
Any open skin, you're gonna stay away from that. I really think we should show them little,
Well, you don't wanna mention these other ones? You don't wanna
Go
do
ahead.
it over breast implants.
No.
You don't wanna do it over epiphyseal plates, in other words, growth
Growth
plates.
plates, so younger people.
Eyes, cancer, as you mentioned, pacemakers, that's a big one.
Yeah, yeah.
Thrombophlebitis, and a laminectomy site. So, all right.
That's on the back where you have after back surgery.
Yeah, anything else, Brad? Otherwise, we'll go right into showing how to use it on this specific site.
Over the eye, huh?
Yeah,
Put that over your eye.
that would be something. All right, we're going to use the phonophoresis on the shoulder. What we like to do, again, phonophoresis works really well with any type of inflammation, so we like to call it the itises.
Right? Itis, Latin for inflammation.
Is it Latin? You know that.
I'm pretty sure it's Latin. I looked that up when I was in school. But
So what type of things? Arthritis, bursitis, and tendonitis.
Right?
Really, we don't really, it really doesn't matter if we don't know which one it is for sure, because the phonophoresis should help calm it down.
Right, exactly.
So Brad,
Are we gonna start with the shoulder?
let's start with the shoulder.
Now, this is one thing, as a patient, when you have a patient, they come in and they're dressed like this and you're gonna do their shoulder, it's like, you gotta get the skin exposed, so, and typically it's up in here is where the shoulder is, right on the lateral side of the shoulder. So, obviously, you go like this, and obviously you're not gonna get up to say, you gotta say, we gotta get directly to the person's body, so you really do have to expose that skin where you're gonna treat. So, I didn't wanna do this, Bob, but this is what we have to
Believe
do.
me, I didn't want him to do it either.
Yeah.
Da, da, da. Oh, you got a shirt on.
Wow, of course, you're getting all nervous, weren't you,
I was
Bob?
getting nervous.
I'm gonna start bulging those massive
Our-
pectoralis major.
And what would happen is that our viewership would plummet, and so.
Come on, okay, here we go.
By the
So-
way, if you are 40 and over, you do want to subscribe to this site, because we are going to cover things that you're going to run into as you age, and we're going to help you keep you fit.
Exactly.
So just hit that little subscribe button.
So, all right, and I do have people, I say, if it's a woman, I say, bring in, a tank top, it's a winter, so they can take it off easily like this,
Sure.
and, it's very convenient. Go ahead, Bob.
The other thing I like to do is make sure that the arm is supported. The bursa, if it's more of a bursitis, a lot of times I have it back a little more, because that exposes the
Sure,
bursa.
yeah.
But otherwise, the shoulder, a lot of people think this is the whole thing is the shoulder. Really, the shoulder is from this point and down. So that's where the phonophoresis would be. Now this is just a gel. This would be, you use this if you are not going to apply any medication. This is the medication we're using here today. This is called ketoprofen. It's an anti-inflammatory. It works well in doing phonophoresis. Hydrocortisone cream is another one. Dexamethasone apparently is another one, which I haven't used, but I think you use with iontophoresis, right? So,
And that's up to the therapist. As a patient, that's.
you want me to put some on?
You bet.
So, I'm just going to squeeze it on.
It's usually a little cold. Sometimes you may be lucky and the therapist has
That's not enough, but just to show.
has their product warmed up so it feels good, but it's not a big deal. It's just cool for a little while.
So anyway, it's very simple. We're just going to start the machine, and we put it up to the correct intensity, and then just a slow rub like this, basically, and you generally are probably not gonna feel much of anything.
Right. I always say and actually sometimes when I go right over the sore spot,
Then it
they'll
might
say,
feel it.
oh, I feel it right in that spot, so I either adjust the intensity or I change where I'm doing it, or the speed of the motion of the machine. And one thing I wanted to say while you're doing this, and this usually is a 7-minute treatment, but it actually will heat up as well, the tissues, and it does that as the sound waves go through the tissues, it vibrates them in your cells, rub together and create friction, and that's how heat is produced with this treatment. So there's that thermal aspect of it, there's the mechanical aspect of the vibration, which get things moving to help get the medication in, and of course with the ketoprofen, the actual anti-inflammatory.
Again, 7 minutes, probably at least 3 treatments to see if it's gonna help. Generally, I don't, for most people, it does not help after 1 treatment. That's been my case.
Right.
I very rarely does someone come back after the first treatment and go, oh, that was great.
Right.
It's generally more 3 treatments.
Right. But it should be totally comfortable, no pain-free.
Yep. Thanks a lot.